Hi everybody, I am Dr Prithviraj Deshmukh, orthopedic surgeon, orthobiologic experts and pain management specialist at Nexus Day Surgery Centre. You all must had a knee injury or maybe a spine injury or maybe even a chronic condition which is causing you low backache or knee pain. Most of the times you must have visited the doctors, and by now we all have been pretty much aware about the plasma therapy or the autologous conditioned plasma. And it's very common, you all must have taken a second opinion, and most of the second opinions, the doctors, they usually discourage taking the plasma therapy, and you usually will advise you to undergo the surgery. Surgery is a treatment, and I'm not at all opposing surgery, as myself I'm an orthopedic surgeon, but what I feel is the surgery should always be the last option and not the first option. And there are various reasons. It's not so that the surgeons who have been advising you the surgery wouldn't have tried the plasma. For sure they would have tried the plasma, but the things didn't work. So today we'll be discussing why the plasma therapy doesn't work with most of the times. First of all, the thing is, clinical diagnosis and the clinical therapy for the plasma therapy is not enough. Here at the Nexus Day Surgery Centre, we have a very well established orthobiologics lab which customize the platelet dosage according to the condition and according to the requirement of the patient. It's not just like one size fit for all machine. Here we have a machine which can create leukocyte poor as well as leukocyte rich plasma, and we can even manage the concentration of the platelets with the technology available only at the Arthrex. Apart from the preparation of the plasma, we also expertise in the ultrasound imaging or the CM guidance fluoroscopy. It is very important that whatever injury you have, the plasma therapy which you are using should exactly reach to the point of the injury and should go on the targeted spot. For that, we utilize the ultrasound imaging technique. You need to identify the spot which is injured. For that, we need to do extensive investigation. We need to do extensive investigation of the MRI. We need to find out the exact cause, whether it is an ACL tear, whether it is an MCL tear, whether it's a meniscus, or maybe it's a disc bulge. But before giving the treatment, you need to do. Once you find out the issue, what is the issue on your MRI, that is the time when you call the patient for your appointment. Once the patient is there for the appointment, we do a diagnostic ultrasound examination of the soft tissue, and we try to identify the lesion on the ultrasound. Once the lesion is found out, then that is the point when we use the plasma which is specifically customized for you depending on your condition, and we targetedly inject on the spots. Various conditions have various dosage. Because of inadequate or proper training in the field of orthobiologics, most of the orthopedic surgeons who are not an orthobiologic expert won't usually harness the autologous conditioned plasma or plasma therapy to its optimum level. So as if you know, Nexus is the best place where we have the expert doctors, we have a very well equipped orthobiologic lab, we have ultrasound imaging techniques, we have fluoroscopy techniques where we can target the point of your injury and we can inject the plasma cells on it.